The first of the speakers in the Meet the Watchdogs session is Tod Cooperman from ConsumerLab.com, who's been around with us for quite a long time. Welcome back.
Thank you. Can you hear me all right? Yeah. First, thanks to ODS for inviting me again. I always enjoy this meeting. It's my favorite meeting of the year. Also for accommodating my schedule. For some reason, ODS always schedules me to speak on the day of a prom of one of my kids. So yesterday I attended my son's prom, and I enjoyed it, and thank you very much for moving me. So I never have enough time to speak, so I'm going to speak a little fast. But ConsumerLab.com basically is a group that is out there to identify better quality healthcare products, mostly in the dietary supplement area, also in terms of healthy foods that are out there. So we're both testing and also reporting information. We've been around since 1999 when I founded the company with an FDA researcher who had been testing supplements but really not been able to say much about them. And we are identifying, again, the best quality supplements in health and nutrition products through independent testing. We've tested over 6,000 products, over 900 brands. We have over 8,000 individual subscribers to Consumer Lab. So mostly individuals, nutritionists, healthcare professionals who get our information online. It's $42 a year. And actually, if you don't have Consumer Lab and you want access, we're going to hand out a sheet of paper. You can put your name down. We'll give you 3 months of access so you can kind of experience Consumer Lab. You'll get a newsletter twice a week. You can always unsubscribe if you don't want to keep getting it. We're in the news a lot because of what we report on, which is really the quality of supplements, both good and bad. I founded the company 1999. Our head of research for the last 13 years is now Dr. Mark Anderson, who actually is a pharmacotoxicologist with 22 years of experience. Unlike our initial head of research who came out of the FDA, he came out of industry, which was great for us. So we kind of know both worlds and how things work. So why can't we just rely on the FDA and GMPs? And you probably already heard this early in the work, but we can't because the FDA does not approve supplements nor register them, as was mentioned earlier. GMPs, the good manufacturing practices, are required, and they can help, but they do not set contamination limits. That's left up to the manufacturer. Ingredient identity parameters, left up to the manufacturer. Testing methods, which is really where the rubber hits the road, left up to the manufacturer. And maybe someone else might have mentioned, but 54% of GMP inspections in 2018 fiscal year resulted in citations of infractions, most commonly for not specifying or verifying the identity of ingredients. So what we do is we go out there, we buy products off the shelf. Products cannot be sent to us. We put out a new report every 2 to 3 weeks. I'll show you some of the recent reports. We also have an independent quality certification program, actually even older than NSF or USP, where companies can voluntarily come to us and have products evaluated, which is great because it allows us to publish information on more products than just the ones that we can afford to buy off the shelf and test. We also do special testing for academic researchers. So we're cited in various papers when researchers want to have a product or a placebo tested ahead of time so they know what they're testing. And we appreciate that ODS has pushed companies doing clinical trials to make sure they know what's in the products that they are testing, because that wasn't always going on. So we put out these product reviews focusing on a specific product category, for example, multivitamins or magnesium or CBD or weight loss products, and I'll show you some of that. These come out about every 2 to 3 weeks. We also are constantly looking at the clinical literature, looking at what studies are showing in terms of supplements primarily, and reporting on that very succinctly and giving kind of our take on these studies, some of which are good and some of which are not so good. We also answer questions from our readers. Every week we answer a few questions, how to take something, drug interactions, all kinds of questions. We have about 600 answers on the website. We report the latest recalls and warnings regarding dietary supplements. And we also have an encyclopedia of natural health care products. with even more detail about some of the clinical information on supplements. And our newsletter goes out twice a week to all of our readers, and then anyone else who wants to get it, that's a free newsletter. The reason why people use our information, as you might guess, are they need to understand which supplements are best quality. Some people say, I use your reports to help protect my patients, obviously. And even groups within the industry, feel that Consumer Lab is an independent organization that consumers trust to help them choose quality vitamins and supplement brands. So we are kind of a thought leader. The people who read our information are thought leaders, and companies respect the fact that we're doing good work. And we're very careful in what we do. Every time we put out a result and we find a problem with the product, which is often, that has gone to 2 separate laboratories before we've even published that information. So we're very certain about what we're publishing. We've tested over 100 categories. These are just examples of some of the types of supplements that we've tested. And the ones that are more popular are retested about every 2 years. Those that are less popular, we might revisit those maybe every 4 or 5 years. We're constantly adding new categories as well, like CBD last year. In terms of what we find that the most common products that fail our tests are herbal products. They're probably the most complicated products out there. And also you can find contamination, in herbal products such as heavy metals. Vitamins, minerals, 17% of those generally fail our testing. The simple, vitamin C products typically don't. Occasionally there might be a product that doesn't break apart properly, but typically they'll have the vitamins. However, we have found, and as we were discussing gummies, that we've found more problems with the gummies actually than other products out there. They are harder to make, as was mentioned earlier by one of the speakers. Some companies have gotten much better at making gummies. I think those that kind of jump in don't do a very good job. And even with some major brands that we see out there, particularly with things like vitamin D or really more folic acid, it might claim to have 400 micrograms of folic acid, but we might find twice that amount. And when you convert that, to the DFEs for folate, people are getting way over the upper limits. Companies, as you know, don't identify when a product contains more than the upper limit, even based on what they claim, let alone what's actually in there, which would be a nice thing, I think, for the industry to address at some point, to actually identify when products have more than the upper tolerable intake limits. In any event, overall, we find that about 1 out of 5 products, a little more than 1 out of 5 products, don't pass our quality reviews. Most common problems we find are too little or no ingredient, too much ingredient, as I was just mentioning, especially with gummies, where companies, they do have to put in 100% or more, as it was said, but how much more, is the question. Sometimes they have 2-3 times as much as they claim. Inadequate labeling to describe an ingredient, poor quality ingredients, spoilage of oils, contamination with heavy metals, inadequate disintegration of pills. We test every tablet, caplet to make sure it'll break apart, so at least it will release its ingredients, and we do find issues there as well. Unapproved label claims, we're looking at the label, not just what's inside the bottle. How do we do these reviews? We select these products from the market. We do a survey of our readers every year. That helps us. We look at what's being sold on Amazon and elsewhere. And we always purchase these at a retail location. When I say retail, it's the way that a consumer would buy a product. So it could be through a multi-level marketing company. It could be through a healthcare provider. More routinely, it's at a pharmacy or Amazon.com. We do the pill disintegration testing in-house. All the other tests are sent outside. I don't know if I'm making that noise. To outside laboratories, because we do so many different types of tests that we're much better off using expert laboratories. If we're doing a fish oil, for example, we want to look at heavy metals, which might be best done at one laboratory. We want to look at spoilage, which might be best done at another laboratory. DHA and EPA levels somewhere else. PCB levels at another lab. So rather than try to be an expert in all these types of tests, we use a lot of outside laboratories who are expert in their field, and our head of research is constantly monitoring them. We publish those results online, pass or fail in our reviews, and I'll show you what those look like. Products that came in through our voluntary testing that have been approved will also appear in those reviews. And we're the only group, there's USP, there's NSF, there's us that are out there testing independently. We're the only one that actually truly is going and buying things off a shelf and testing it. All the others are relying just on companies coming to them. But we're the only one actually that publishes how we do our tests for free online, so that if you click that link, you'll see exactly how we do our tests, what our standards are, what methods we're using when we evaluate each type of product. So I'll just show you an example. I'll start with quickly magnesium, but I'm going to jump over to weight loss quickly, since I know that was brought up yesterday and is of interest. So these are magnesium, calcium, magnesium supplements. It's a very long report, a summary, but I'm going to shoot down. We get into the clinical information about what magnesium does, but I want to get down to our results table here. So here's really where we're showing what we found in testing these products. If they had exactly what they claimed and no other issues, they are approved by us. It doesn't mean they're necessarily the best. We do actually then go back and pick what we think is the kind of the top pick, which we identify looking at all kinds of factors, including quality, what's in the product, and also price. Because you can get some supplements, really good multivitamin, et cetera, for very little, 5 cents, 10 cents. You don't have to spend $1 a day, to get, basic nutrients. I'll shoot down, if you look at that third column, here's one that wasn't approved. This was more for a labeling issue. It didn't define its enteric coating, which is a requirement. More of a technicality. Here's another one. If you look in red, it didn't disintegrate within 30 minutes, which is a requirement, a USP requirement. It required more than 60 minutes. Sometimes we just let the test keep running just to see how long will it take for this product, to disintegrate. Let's see, some other issues. Most of these products, as you can see, this is magnesium, and most of these are approved products, so most companies are doing a good job. Here's another one. This one, Algae Cal, let's see, a little less magnesium than it claimed, a little bit of lead. And when I say a little, I know people might say, well, any lead is bad, but we've seen much higher levels of lead in some products. Here's another product that didn't quite disintegrate on time. But again, I want to shoot over to the weight loss, because we just put this out last Friday, a week ago. I'm just going to go to our latest results. These are weight loss supplements. Because here we did find some significant issues. Again, we have a review of what these different ingredients for weight loss do. As mentioned, none of them have any great evidence that long-term, weight loss will be achieved. Some of the stimulant blends probably do have some benefit short-term. And so we looked at caffeine, we looked at 7-keto, and we looked at, I'll get to the third one in a minute, but this is just comparing the cost, just from a cost perspective as a consumer, how much do you have to pay to get this 7-keto DHEA if that's really what you want. And you can see that the cost varies from about 33 cents to $1.40 for the same amount, 100 milligrams. Then we looked at the amount of caffeine that are in these different products. It ranged from 51 grams up to 270. This is per serving. Europe has limits on how much caffeine can be in products. It shouldn't be over 200 milligrams per dose or 400 milligrams per day. And for pregnant women, lactating women, it's lower. So there are some of these products, the ones that are in the red, actually already have off the bat. This is per serving, and some of these are twice per day. Huge amounts of caffeine, which we want to point out to our readers. Forskolin is the other ingredient, an herbal product that we looked at. And here are our findings. This is we've come to a new format that works better in mobile here, but if someone were to choose 7-keto, here's our top pick, for example. It passed all our tests. It was lowest in cost. We didn't see too many problems with those products, but when you get to some of the stimulant blends, this was a synephrine, a bitter orange product. This actually had twice the level of synephrine that you'd expect from the label. It had a dangerous amount of synephrine in it. let's see, this one just had 3.7% of the listed amount of forskolin. So it really isn't even providing what you would expect. Yeah, so I just wanted to make sure you got some sense of what we see. And I wanted to skip over now to, let's see, some other findings. So CBD, certainly on everyone's radar right now. So what we did when we went out and purchased CBD, and CBD is one of those situations where it's a black box in many cases. It's kind of a cat and mouse game with the industry and the FDA. If you say how much CBD is in there, then it's a drug. Then it shouldn't be on the market. If you don't say it, maybe you can get away with it. And there are other things that they could be saying on there that can raise red flags. So we want to know really how much CBD is in products. What we found is that the amount ranged from about 1 milligram to 22 milligrams per dose. You really couldn't always tell. Some of them are properly labeled, and that's fine, and I'm out of time as usual. THC, it's in these products. Just be aware. I get calls from reporters all the time where people are failing drug tests, and they're saying, why is that happening with a CBD product? So THC is in most of these products at low levels, but a concern. But it's going to be things that really have to shake out a lot in this industry in terms of CBD. And the cost ranged from 80 cents for a 10 milligram dose to over $4 for a 10 milligram dose of CBD. So it can be very expensive, or either way, it's going to be expensive, but it can be a lot more expensive depending on what you choose. I'm going to skip the other ones. And again, I don't know if that thing is being passed around, but feel free to put your name and email down, and we'll give you a free access to the site for 3 months. Thank you.
I'd like to introduce Laura MacCleery from the Center for Science in the Public Interest to tell us what her organization does in this space. Laura, nice to see you again.
Hi. So I'm Laura MacCleery. I'm Policy Director for Center for Science in the Public Interest. Let me see if I can get this to work. Oops, I'll use the arrows here. That works. This is who we are. We work for consumers and the public health. We don't take any money from government or companies. We've been around for about 50 years, and we're a public policy advocacy and information organization. We publish a newsletter, Nutrition Action Health newsletter. We also litigate against companies on deceptive labeling claims with our litigation department, and we bring administrative cases against federal agencies. We work in the Congress. We do public information and advocacy. This is pages from our Nutrition Action Health newsletter. I know it's hard to read, but similarly to consumer labs, we often look into claims and the safety of products in the dietary supplement marketplace. Subscriptions to Nutrition Action Health letter are about $12 a year, and I think that the newsletter provides a lot of value. In this example, for example, the cinnamon, fenugreek, chromium, Gymnemia sylvestre, and bitter melon basically had no studies showing efficacy. There was a little bit of information in an old study on fenugreek showing that it might be effective, but no recent information. We also looked at things like green tea extract, which is actually linked to health issues, Prevagen, or no Q10, and found that the claims around efficacy had been doctored or were false. On testosterone, which is approved as a medical drug for some uses, we looked at some of the evidence and really found that the advertising was misleading. The company convinces people that the condition is really common, that doctors fail to recognize it, and that patients need to make the diagnosis themselves so that they can get prescriptions for testosterone. And so this is an example where there's sort of a crossover, there's a creation of a medical problem in the mind of the consumer, marketing of a supplement into that gap. There's also mixed information in terms of the use of probiotics. We note that if you really don't have GI tract problems, you shouldn't be taking it the same way you would a multivitamin every day. It's really not necessary, and that there's poor labeling on probiotics of the particular strain, and so consumers just aren't informed about what they need. And maybe taking it, and they're quite expensive actually. We worked a lot on the issue of pure powdered caffeine. This was 99% or 97% caffeine that was sold in bulk form in like big bags of powder. It was lethal at a tablespoon or two. It was lethal for a child at a single tablespoon. And yet it was sold in 5-pound bags over the internet. It was also sold in big gallon jugs of liquid that were lethal at like a half a cup. This is a young man, two actually, who died the same summer. 23-year-old and a 17-year-old valedictorian of his class who was just about to graduate. Really tragic. He was studying for finals, and he took a little bag of powder that a friend had given him and went into cardiac arrest. So we submitted a petition to ban this substance, and in April 2018, 4 years later, the Food and Drug Administration issued an enforcement guidance effectively banning direct sales to consumers of pure concentrated caffeine products. I'll note that they had issued a number of warning letters before that had gone after the main parts of the market and put producers on notice, but there were still some products being sold online. It's a thing that's very hard to patrol without a uniform statement from FDA. We've also recently published a series of letters. We just did one on tobacco cessation supplements, and we're working on one on fertility supplements. But this is investigations that look into particular aspects of supplements that are making disease claims. Opioid addiction withdrawal supplements are not supported by any evidence of medical efficacy. It targets very vulnerable populations who are trying to deal with addiction and may not have access to medically approved treatment options for opioid addiction or may be facing severe stigma. And so these supplements sell, I think, very exploitively into this kind of void with highly vulnerable populations. We made the similar argument around tobacco cessation supplements. We just sent a package, and believe it or not, what we do is we write companies and we say, what's your evidence of efficacy? And often they write us back and say they don't have any. And so then we put those answers in a chart and we give them to FDA and say, these companies told us this, and we urge you to take action around disease claims. Disease claims are an enforcement priority for FDA because they interfere with the access of consumers to medically approved treatments. Here's some examples of what the companies told us in the opioid addiction case. We don't really have any scientific studies as such currently. Scientific studies are very costly, so no, there's no study. In this case, FDA actually reacted very quickly, and the Federal Trade Commission got involved as well. FDA regulates the label on the product, and FTC regulates marketing claims made around the product. And they both took action against actually more companies than we had identified in our original search for these products. We also continue to be alarmed about the amount of tainted products. As you saw in Todd's analysis, there are products that are spiked with drugs or contain higher levels of prescription drugs in them than they should. The common categories are weight loss, sexual enhancement, and workout enhancement kinds of products. These are sold often on sort of fly-by-night websites by individuals touting unbelievable success in this or that activity, and they're often amphetamine-laced or laced with other drugs. And the trick here is, FDA does have a testing regime. This is FDA's test results, but they just rename the product. So Boost Ultra would become Boost Ultra Plus, or Tiger this would become Tiger, from the jungle or whatever. So, that's a real problem because the agency is really playing whack-a-mole. And it's one of the reasons why, as you'll see, we're backing a listing and registration requirement for manufacturers, which would really help kind of surface and make visible when a particular company has just retitled a product. We also are concerned about adulteration. Todd mentioned that as well. Ginkgo biloba is one of the most adulterated products. There's also, spotty evidence on the efficacy of ginkgo, so you're in the weird position of arguing the ginkgo isn't in the bottle and also it doesn't work, even if it were. It's like, the food was terrible and the meal was too small. But anyway, we made both arguments in a letter to FDA and told consumers in general to avoid ginkgo. They basically use the other parts of the plant to try to trick the good manufacturing practices tests rather than the parts of the plant that are known to be efficacious. So, we think that there's major failures in the dietary supplement marketplace. There are first principles that are routinely violated around dietary supplements. Products should be safe, the claims should be true, the thing on the label should be inside the package, the limitations of the product should be clearly flagged, drug interactions should be made clear, and that if there's a serious reaction or further evidence that evolves around adverse events, that regulators and consumers would be made aware and take appropriate action. We also have a problem with the new dietary ingredients loophole, and FDA just had a public meeting on this, and so I just want to spend a minute on that argument. It's a pretty complex issue, but basically FDA is supposed to review new dietary ingredients, and since DSHEA was enacted in '94, they've only looked over a scant handful of them, around 1,500, with the number of products in the marketplace that suggests a significant gap. When Congress, in its wisdom, wrote DSHEA, it made an exemption for foods in the food supply that are generally recognized as safe or GRAS. And what the industry said at a public meeting a year ago was that there are 6 to 7 times more uses of the GRAS authority by companies to get products into the market than are submitted to FDA in the NDI process, meaning that the loophole for food substances that are generally recognized as safe has swallowed the NDI approval process that was supposed to assure the safety of new dietary ingredients. And FDA didn't help this. ODSP put out a draft guidance in 2016 that said explicitly that the GRAS status of a food substance could be used to evade the NDI reporting requirement. This is a guidance in draft, and we would suggest that we're working on comments to suggest to FDA that they should close this loophole. GRAS in the food supply is a huge loophole in general around the safety of food additives and ingredients. It basically allows companies to self-assess the safety of an ingredient and put it in food and never tell FDA the basis for that determination or that they've made that decision even. This is how we think it more or less works. So I'll skip ahead. We do know that this is a problem in the supplement market. The Natural Resources Defense Council put out a report a few years back showing that when substances were told to FDA that they were going to be determined as GRAS, these are called the GRAS notification process, and FDA raised questions about the safety of those ingredients, and some of these are pretty serious objections like leukemia. The companies then withdrew the notices from FDA, and other companies or those companies presumably self-determined that those were generally recognized as safe because they showed up in supplements on the labels, and there was never an NDI filed. We do think in general that GRAS is broken. We're in court in the Second Circuit with partners challenging the FDA's oversight of the GRAS loophole, and there's a lot of problems with the oversight of food chemicals in general. Our priorities on dietary supplements are safety and efficacy. So we think, obviously, there's a need to protect the public from acute risks, and that's why we took action on pure caffeine. We also have a pending citizen petition on requiring a warning label on St. John's wort to flag drug interactions, and we think, in general, the products that are widely sold in the dietary supplement marketplace that are where there is known evidence of drug interactions should blanketly be required to have a label on the front of the package that informs consumers of that interaction potential. We also worry a lot about disease claims. Consumers go into the CVS and they walk down the aisle and they have no idea that OTC drugs are regulated so fundamentally differently than the dietary supplements that are sold right next to them, and that the claims are regulated differently, and the potency and the adulteration issues and all of that. So we think that around disease claims there's a real opportunity for enhanced enforcement. In addition, we're worried about claims, and here we talked, there were a lot of good questions about claims after the last panel. I would encourage you to keep asking those questions. I find the industry's answers most unsatisfying. One thing to know is that because of a quirk of the law, there is a bad case out of California called King Bio, which has basically required that if a plaintiff's attorney wants to bring a challenge on deceptive labeling grounds to a dietary supplement, they have to prove affirmatively that the company knows that the claim is false. That's very different than proving that there's no evidence for the claim. It presents an unreasonably high bar in court. And so there's been very little plaintiffs' litigation over the efficacy of claims. Under the Class Action Fairness Act, this bad precedent has been adopted across the federal circuits. And so the normal sort of marketplace disciplining effects around claims, given the scant resources at FDA and the commonness of the practice, is broken. The regular sort of accountability that you might find in the courts is broken because we're really just dependent on FDA and, in some cases, the Federal Trade Commission to patrol this marketplace, which is enormous and vastly outstrips their resources. So what we would like to see, we'd like to see product listing and registration. We'd like to close this grass loophole and ensure that new dietary ingredients are actually reviewed as was intended in DeShay in 1994. We'd like to address high-risk and tainted supplements with pre-market safety tests in particular categories that pose a high risk to consumers that would be visible to the agency from the listing. We'd like to have meaningful product labeling that actually impresses upon consumers what the disclaimer means, warning labels pertaining to drug interactions, as I mentioned, and a 1-800 number for direct reporting of adverse events to FDA rather than only serious adverse events that have to be reported secondhand. And then adequate oversight. We want to double or triple or quadruple the budget at FDA for supplement oversight. We'd like to see the finalization of the draft NDI guidance. There should be a process for evaluating dietary supplement claims. And then there should be criminal and civil prosecutions where it's supported by evidence. In addition, I think it's worth thinking about whether the issues that Todd raised around the good manufacturing practices could be addressed. A lot of the larger companies in the space have protocols in place to address things like contamination, ingredient identification, testing methods. I would suggest that this is an idea that we could probably all get behind in terms of basic standards for products, particularly in conjunction with a listing requirement. So, the ingredient of a product that's listed is identified clearly by the company. And then we're also at CSPI looking at CBD and THC in edibles and very concerned that there isn't a public health lens in the legalization debate. We are not taking a position on legalization. We just think that how we go about it should be informed by the public health risks, and that consumer transparency and a sort of regular order has been lacking because of the way that this issue has moved forward. Thank you.
So now it's a pleasure to introduce Sally Squires, and she'll probably tell you some interesting stories. Sally has been publishing and reporting in the nutrition/dietary supplement space for quite a long time. It's nice to see you again.
Right, great. Okay, great. Well, thank you, and I'm delighted to be here. I knew Mary Frances Picciano, who was just a wonderful person. She and her husband, John Milner, who sadly neither one of them are with us anymore, but I'm really glad that that ODS has done this. So thank you for having me here today. So I'm going to talk to you today. Let's see. Okay, so this is what I will discuss today. I'm going to give you a little bit of history, and then talk about, and I suspect you've covered this somewhat this week, but talk about the growing consumer interest in dietary supplements, particularly with an aging population. And as one who is now actually on Medicare, I suddenly have a better appreciation for Part D and the costs that are involved, and I see why so many people are looking to help reduce their costs of drugs. I want to talk to you a little bit about how I approached best practices. So Paul told you, I used to be I was at the Washington Post for 24 years as a health and medical writer. And for the last 11, I've been in public affairs, and also I'm an independent journalist and a contributor to WTOP, which is one of the, for those of you who aren't in the area, is the leading all news station in Washington. And so we talk about a lot of different topics related to nutrition. And I thought I'd kind of show you from the lens of a journalist, or the way journalists are supposed to work, how we look at various topics and really do the research that should be done, isn't always, but should be done to to give readers and viewers and listeners the best information possible. Then I want to talk a little bit about a personal case study and how I used not only ODS but also Consumer Lab to help investigate something. And I should hasten to add that all the opinions that I'm expressing are my own solely. So let's see, I think there we go. So this is a little bit tricky with the scrolling up and down, sorry. This is why you shouldn't do a PDF, I guess. There we go. So this is from the Council for Responsible Nutrition, which is the trade group. Let's see if there we go. This is a trade group that is made up of many dietary supplement manufacturers. And 75%, so 3 out of 4 people in the U.S. are taking dietary supplements, which is up significantly from 10 years ago. You will see that we've known for a long time that dietary supplement use is often a marker for other health behaviors. So among those 55 plus, nearly 8 in 10 are taking dietary supplements. You can see it ratchets down a little bit, but I think it's surprising that even among the millennial group who are very, very interested in health and good nutrition, that almost 7 out of 10 are taking dietary supplements. So how do supplement users differ from non-users? Well, again, here's this marker of good health. So we know that supplement users, they tend to exercise more. They go to the doctor more regularly. They try to eat a balanced diet, a little bit more than others. And, sleep we know is a really important topic these days, and they are also kind of on board with that. They also are working successfully to maintain a healthy weight, and then they are not smoking. So this was interesting. As I looked, I was kind of curious about how does supplement use compare among consumers with health professionals. And it turns out that actually worldwide, health professionals take more dietary supplements than consumers. And in 2016, if you look globally, so this isn't just a phenomenon or a trend in the US, but that globally the dietary supplement market was an estimated nearly $133 billion in US dollars, and by 2024, it's expected to reach nearly $278 billion. So if I put on my journalist hat, this is what I do to think about covering a particular supplement or a question about a particular topic. One, I always go to PubMed, to the National Library of Medicine, when we're right here, which is just a fantastic resource. And I start there to look at journals and topics. We used to joke at the Washington Post that a story was anything that happened to a reporter, and a project was anything that happened to the managing editor. So, and there is some truth to that, but I think we're all consumers. We all have either friends or family, and we hear things, we see things that we want to know more about. And so, topics that I think will be of interest to consumers, to readers, listeners, viewers. That's that's where I start with that topic, and then I go to PubMed and I start doing a literature search to see what's been written about it. What do we know, and how credible are those sources? So then I will turn, particularly for when it comes to dietary supplements, ODS is one of the first places I look. I also go to the National Academy of Sciences and Medicine, to the FDA, the Federal Trade Commission. You've heard that both FDA and FTC will sometimes take makers to task about claims that are made. U.S. Pharmacopoeia is another one, USP you've heard. Consumer Lab, and I am both. I've taken advantage of Tod's offer, but I also pay for that subscription too when that offer ends. And it is a really good resource, and I have no financial connection with him whatsoever. So I just want to hasten to add. And then I go to, this was one of the things that I learned. I'm from the Columbia Graduate School of Journalism, and I learned that it's really important to have a really great group of scientific advisors that you can turn to and you can say, hey, what do you think about this? And they don't necessarily show up in your stories or your coverage, but they're kind of a sounding board or a board of directors or a kitchen cabinet to help you make sense of what is happening and or what the latest findings are, and just to really kind of get a pressure test on all of that. The other place that I have often found at least good basic information is the Linus Pauling Institute at Oregon State University. Has a pretty good database. Again, I don't take any of it as complete fact, but they have some good references, and it can point to some other places that can help. And now I'm going to actually also add the botanicals. I'm really glad to know what Meryl said, talk to us about, and those resources. So then it is also really important these days. There's the news cycle is so fast that sometimes time isn't taken to really look at a topic from a 360 perspective, but I do look at what consumer groups like CSPI, what industry says, what trade associations, and obviously academia says, and then compare them all. So to me, that's the lens that you kind of try to get the biggest picture you can. And I know that I've completed the circle when I start to hear things from the next person that I've interviewed that are telling me things that I already know. So then I know, okay, we've gotten as much as we can right now. So I want to tell you a little bit about a personal case study. I read this book that you see on the left, which is by Richard Bedard, and he was a Bloomberg financial editor in Hong Kong in his late 40s when he blew out his knees. And I have some little knee issues myself. They sometimes talk to me, so I was kind of interested in what he did. And part of what he found was that, it's been said that cartilage can't be regrown. And in fact, like many things in life, we're learning that actually cartilage can be regrown. It just takes a very long time to do, and you have to be very patient and figure out the right way to do it. That book led me to Doug Kelsey, who is a physical therapist in Austin, Texas. And Doug has also figured out kind of a way to help turn on some things in the body that won't work for everyone, but it can help people who are having some joint problems, particularly with the knees, recover. One of the things that Doug did that I was really skeptical about is he talks about a lot of supplements to take, dietary supplements, and they range from chondroitin and glucosamine to avo-soy, which is a combination of avocado and soy, and some things that I had never heard of that you can get from seafood and not omega-3s, but a whole variety of different things. I was really skeptical about that, and so what I did is I took each product that he mentioned, and I should hasten to add he had no financial attachment to any of these products, and he was clear about that. But I took each product and I put it into the ODS database to see if there's anything there that was said about it. And then I went to Consumer Lab and I took the product names and I went to see whether or not there had been any adverse problems with them, or if they actually had what they purported to have, and really through that lens then kind of honed in on a couple that seemed like they would help, and have actually used them, and I have found some benefits from that. So, but I think that, again, what this is looking at is that, looking at, it's really important that journalists and anyone else who is thinking about taking these supplements or doing these things really needs to take a close look at not only the scientific literature, but the financial interest, and just see if there are ways, if there are some things here that you might not notice otherwise. So as scientists and as physicians and health professionals, what can you do in the dietary supplement space? So this is something that I've urged American Society of Nutrition. I'm an adjunct at Tufts, and I urge the students to do this as well, is that we need more scientists and people with health professionals out in the whole digital space. And these are places that you can do that. So I suspect you know about some of them. Medium is a place where you can obviously submit op-eds, but it's a really great place to start to share your expertise. The Conversation is another website. If you don't know about it, it is you can only write for it if you happen to be with an academic institution, or you are with a nonprofit and you have to have an advanced degree to write about it. But they have a website that actually has about 5 million visits, I think it's per month, and then they provide their content to newspapers all over the country and the world. And so it's a way to help literally join the conversation about various topics, and it's a very interesting place. I see a lot of things on HuffPo, also LinkedIn, and that's another really great place to get some good information out. There is a column in the Washington Post called 5 Myths, which is in the Outlook section on Sundays, and they take apart different topics, and they don't all relate to science, but it's another really good place to, if you have something to say and you can provide something, that I think it's worth giving it a shot. And then a variety of consumer outlets. And I just wanted to leave you with this. I mean, right today, as we speak, the FDA is actually reviewing CBD products and kind of looking at what the next steps should be. If we haven't learned from the measles epidemic that bad information on the internet is a really big problem, public health problem for all of us, then I think we have really missed the lesson that should be teaching all of us. And with that, I just wanted to say thank you, and this is where you can find me.
So thank you to Todd and Laura and Sally for starting a conversation about, and you want to get in here. So let's go ahead and take your question first.
I was actually waiting for the whole panel to form to ask my question, and my question was actually formed in Ms. Squires' case very briefly, because I was like all through the case. By the way, I'm Bibi Beba, and I'm from Maryland University of Integrative Health, Doctor of Clinical Nutrition program. I'm a doctorate student there. So my issue is actually for both the health professionals and the consumers to find one credible place to go for a supplement brand or the particular supplements. So I see that there's a bunch of resources out there, and you're all doing a phenomenal job, including the government organizations, to create your own resources. And I was actually planning to be a Consumer Lab subscriber. Now I will be definitely. But we need actually one place to go. So are you in any collaboration or any thought process to, like, instead of me going and checking it from the ODS webs, like, database, and then going checking it at the platform, is it possible to do that? Is it possible to have, like, oh, these are the companies that I can trust as a practitioner, and I can just forward my patients so they can check there as well?
There we go. It's a really interesting question. There is nothing like that exists right now. I have had some discussions with the American Society for Nutrition, of which I'm a member, to do something that would actually, what I wanted to do is called the National Nutrition IQ, which would look at the knowledge of consumers and compare it to other groups, but then also be a vehicle to help advance the knowledge of of consumer, of everyone. And we haven't gotten that off the ground. My own website, which is actually getting redesigned as we speak, I'm hoping to actually do more things like that could help point people to the right direction, but I don't know of anything that actually exists right now.
Todd or Laura, do you have anything you wanted to add to that?
Yeah, it would be great if that existed. We all like what each other do, but not looking to create one thing. But everyone does something a bit different, though. So like Laura's group is so active trying to get things changed. We're out there trying to show people what's going on so that Laura's group can then try to get things changed, and then Sally, can take advantage of that and explain that to consumers, in stories. So there are lots of different pieces to all of this, and ODS is putting out, really solid, objective information, so that for free, so people can get it. So unfortunately, lots of different things, but nothing unified.
I'd be inclined to say in response to your question that the search that Sally did probably represents a logical way to do it. It takes some work, and there isn't a single source of information. Much as I love ODS, it doesn't tell you everything that you as a consumer might need to know about every dietary supplement product on the planet. So there's...
On efficacy, I would add to look at the NIH library. There is a good, it's not all inclusive, but there's a decent roundup of efficacy of particular supplements that wouldn't necessarily be flagged in other resources, and that are, briefly explained. What I find dealing with consumers is that there's claims being made in the marketing materials or on the label around scientific studies, but they're very poor quality studies, and you'd actually have to sort of delve into the particulars of a study to see that it doesn't actually provide compelling evidence of the efficacy of a supplement. So the NIH library resource is a great shorthand for the ones that they've looked at.
There are two people over here. You can fight it out between yourselves.
Thank you, Bryn Austin from Boston Children's Hospital and Harvard School of Public Health. Wonderful panel. Thank you. Laura, I was a little bit disappointed to hear about the roadblocks you pointed out in civil litigation. I'm wondering, though, about state attorney general litigation. Do you see that as a more promising avenue for the biggest rule breakers?
I think they have a lot on their plate, and it's hard to get their attention to supplements unless there's a sort of chronic threat, which is not to say some AGs, like the New York AG, brought a case on adulteration that produced some results for some of the major retailers like GNC, and was a good settlement agreement. We certainly would love to have greater attention from attorneys general on this issue, and they are not barred. They can bring straight up, false claims cases that case law I mentioned doesn't apply to them. So they do have a wider hand, but they also have a huge number of consumer protection obligations to pursue. A lot of them are focused on opioids at the moment, and for good reason. There have been some cases around the Prevagen issue where the company cherry-picked the data on efficacy, and there's been the ability to pursue some claims, but it's really few and far between compared to what you might think.
Gentleman next to you.
Yes, thank you. My question for Dr. Cooperman, I've been a subscriber to Consumer Labs for at least a half a year, and it's very useful, but there's some fairly sizable companies seem to get excluded from the process to some degree. How do you figure out how to expand it so you cover all the reasonable manufacturers?
Right. It's our biggest challenge is to test every product. As mentioned earlier, there are 40 or 60,000 products on the market. We are not excluding anyone from our testing. We are looking at what our readers are using mostly. We do a big survey every year. 10,000 people respond to that survey. So please respond to that survey and let us know what you're using, because we don't want to exclude anyone.
And a related question is, once you've tested several products for a company, can you predict that they're going to be safe and effective, or provide what they say they're providing?
It's a good question. We have found problems with products from, I think, probably any company where we've tested a few, 3 or more products, we've probably found some issue. So I wouldn't, there are some that do a much better job than others. And I do think some of the big retailers out there, even though you might not want to believe it, like a Walmart, can do a great job because they're pressing those suppliers really hard, and they don't want to make a mistake because they have huge liability, if they make a mistake. So sometimes, we can find a great product from a Costco product. Sometimes we don't. But generally the companies that have more at stake do a better job.
Yes, over here in the middle.
Hi, John Miklovic from Chapman University. Laura, I thought that was a really interesting comment about cherry picking the efficacy data. I think we see that in a lot of science. I think we see it in basic, applied, and clinical research where the data is cherry picked to tell a story, something that's interesting to read, something that'll get published as a manuscript. And I think a way of getting around this now is the rise in popularity and in execution of implementation research and in protocol papers. It's now a much more common practice that before a clinical trial is done or performed in its design stages, once it's funded, a protocol paper is published first, and in this protocol it's communicated all the primary, secondary, and auxiliary measures that are going to be assessed. And I'm wondering if this is something that can start to be implemented in the supplements industry as well, where even before some of these studies are done, it's set a priori what is going to be assessed so that cherry picking for efficacy data is minimized.
Yeah, I think that would be very helpful. What we see is that you would get a null result for the study objectives at the end of the trial. I'll say sometimes the study isn't even of efficacy. A lot of the studies that are cited in the marketing claims could be studies that aren't about testing for the claimed effect, right? They're just about testing some other aspect of the product being tested. So that happens. But there's also other studies where they get a null effect and they've intended to test an effect, and then what they do is they go back and they pull a cohort of the participants and they claim an effect for that cohort that may or may not be statistically significant. So those are the there's lots of sort of scientific methodology games being played, and anything that would pin researchers to an intention at the outset and then be a part of the necessary reporting of the results would be helpful. We also have been promoting through a kind of letter writing effort to the major medical journals that they include a searchable, findable field around the funding for studies whenever they publish. So it would be in the abstract, and you could do funding bias research much more easily than you would be able to do it now. And some of them are adopting those practices, but we think if around best practices for publications, that would be an important addition as well.
There's a question over here.
I can just comment, and I just want to add also, I mean, that would be wonderful. I think we'd all agree to that. But people, this industry, the dietary supplement industry, tends to be an industry of borrowed science, right? So, they found something in mice, and now it's in the product. People should just be particularly on the lookout for, proprietary blends. Just a little tangent to what you're talking about, because rarely has a product actually been tested in that particular formula, in these supplements. And there isn't a lot of incentive, obviously, for companies to spend the money unless there's something proprietary. But then you get into a situation where you don't know really what's in it anyhow. So just a red flag, with proprietary blends. They're not all bad, but we're very suspicious of proprietary blends.
And I'll say that that none of the safety reviews that we were even talking about around the new dietary ingredient review would look at mixtures. And so the very fundamental safety of a blend is not something that's likely been tested at the safety level, much less efficacy. But also what we saw, for example, with fertility treatments, when we started looking at this marketplace and we're in the middle of a similar investigation, is a lot of them are proprietary blends and there might be 30 substances. And so what we have to do then is go and do Sally's methodology where we look at the efficacy and safety testing of each of the sub-ingredients. You don't even know how much of them are in an ingredient, and then you find an efficacy or safety test that is at a particular level of that ingredient, and it's probably a higher level than's in the proprietary blend. Oftentimes the efficacy studies are multiples of the whole blend, much less some like 1 of 30 ingredients in the proprietary blend, right? So even if there's some modest evidence of efficacy, by the time it gets shaken up with 30 other ingredients, you don't even know how much is in the product, there's essentially a wash. So, I think that's the kind of challenge that we have and that we face with this marketplace, which is that there's no alignment between the amount of a substance in the product and the underlying science that might support the notional addition of something of that ingredient for some purpose. And that's in contrast. I was at the public meeting at FDA. The Health Canada presented, and I was fascinated because they actually have something like a drug monograph for all their supplements, and they provide the allowed claims, the potency levels, the uses, all of this information, and the supplement manufacturer is bound to that monograph, according to the presentation by Health Canada about a system that I don't know that much about. But I think that would be a much more reliable system from a consumer perspective in terms of creating alignment across the data points to the consumer.
We have time for 2 more questions, quick answers, please. One over here.
Yes, Dan Dykle with Drexel University. I'd like to know your thoughts about the role of the retailer, especially as many of them are uninformed and uneducated in making recommendations to consumers on purchases.
So there is a private standard setting body called ANSI, and they are putting together a retailer working group. I think Jay mentioned it in his slides as an effort that's ongoing. I feel like there is a growing impatience among the retail sector for some of the shenanigans in this sector. And since some of them sell store brand products, where they basically license their name, we have a suit pending against CVS currently for an algal supplement that was making extravagant claims that were essentially unproven. We've also gone after store brand products around eye supplements, where there is a product that's actually effective for addressing eye degeneration in mature adults, but the supplement version didn't have the active ingredient in it. It was sold on the shelf next to the effective product, that kind of thing. Called Arids. I think the manufacturers are not the only ones that face a public-facing liability. Some of the retailers are very invested in promoting and couponing and distributing these products, and that's a direction that we'd very much like to see more accountability. And I think they're aware of it, and that's why they've put together this ANSI working group to come up with additional quality standards, at least.
One more
We'd like to see it
question,
extend to
please.
efficacy.
In the front here.
So Sally, thank you so much for having a well-rounded view of doing an assessment that included not only peer review and academic, but also your science experts and literature gurus. So thank you very much. I have a question for Dr. Cooperman as well as Laura MacCleery. For Consumer Labs, thank you so much for your reviews. I use them with my clients. I'm wondering, because consumers pay a lot of money for the products that medical practitioners provide. And now I'm hearing, because I specialize in cardiovascular medicine, that they use a lot of proprietary blends. Are you testing the ones that are professional use only supplements?
Yeah, we test the professional use as well. So there are several brands in that professional use space. Our take on that, I can tell you an overview, is that the quality does tend to be better.
Good.
The price tends to be much higher. Mm-hmm. Same thing with direct distributor, multi-level marketing products. The quality actually can be pretty good with some of those products, but the price is much higher. So when you look at value, how much you're getting for what you're paying for what you're getting, the value isn't always there really with the professional brands. Mm-hmm. Sometimes you're better off just recommending that someone buy something at Walmart, if it's passed our test, I would say.
Well, also, the thought of a lot of the professional brands is that they're not including magnesium stearate, and that's one of the main things we're using as criteria to distribute a professional use only supplement, especially for the cardiovascular diseases.
Right, so you're talking about kind of different inactive, or not really inactive, but just excipients that are in the product, and you go on and on about the different, pros and cons of excipients and increasing information about some of them being maybe not so good, not so inactive, right? Like titanium dioxide, things like that we were just writing about. But whenever we report, we show all the ingredients that, that it's in a product. We have information about what those excipients do, and people have to make their decisions. A lot of gray regarding these excipients right now.
And then,
Okay, we're going to stop now, I'm
can I
afraid,
ask a
ma'am.
question about
I'm going to
titling?
suggest that you, we have
Always.
two things that you can do. One is talk to people during the break, but we also have another session at the end where you can ask some final questions, and I hope you'll take advantage of that. We need a bit of a break now, and we're about 10 minutes off schedule. I'm going to suggest that we come back at 10 past 11, and if we can do that promptly, then we can get a good discussion period in. So thank this panel for their participation.